Mr. and Mrs. Coltrane are two young anti-inflammatory agents looking for their forever home. Mr. Coltrane is an anti-gout agent, and Mrs. Coltrane treats familial Mediterranean fever. Though the couple already lives busy lives, they are looking to expand their careers by treating pericarditis. They believe that moving into a cardiology neighborhood will allow them to settle down and start a family. The couple has a budget of 1.2 milligrams by mouth loading dose every 12 hours on day 1, followed by a maintenance dosing of 0.6 milligrams twice daily. Will they be able to find their perfect house without breaking the bank?
Our main goal is definitely to get something to treat idiopathic or viral pericarditis.
Yeah, we're not looking for something that's too old. I don't know how well we can handle that.
Yeah, it definitely could get a little toxic if it's older than 65 or so. Want to negotiate the dosage down.
Yeah, we're looking for a pretty low maintenance house, nothing with severe renal or hepatic impairment. Oh, and a walk-in closet.
Mr. and Mrs. Coltrane want a low maintenance house, but they certainly seem like a high maintenance couple. It's with good cause. If our well-meaning couple tries to renovate the wrong house, they could have serious GI effects such as diarrhea, nausea, and vomiting. In rare cases, there could also be fatigue or headache, gout, abdominal cramps, and pharyngolaryngeal pain. With high hopes, Mr. and Mrs. Coltrane begin their journey to find the perfect patient as they meet their realtor showing them the first house of the day.
Hi, welcome. This lovely 80-year-old duplex is perfect for fixer-uppers like yourselves. Notice this lovely front door with paneling that you can use to let in all your infectious agents. We also have a lovely open floor plan where you can entertain other therapeutic drugs such as yourselves.
I noticed some inflammation in the pericardium near the heart. I like it.
Yeah, acute idiopathic pericarditis. This is a great chance to work on your skills.
You said this was 80 years old? Might be a little bit old for me and my wife, but we could make it work if we get the dosage down a little bit.
Okay. Oh, and I almost forgot. You'd be sharing a room. They're in the same job field as yourselves as CYP384 and PGYP inhibitors.
Yeah, that was the final straw.
My wife and I have a very toxic relationship with some of our workmates.
Yeah, we like our privacy.
The day is off to a disappointing start, but this next house certainly has more than enough problems for our couple to fix.
Hey, sorry, I forgot you were coming today. So I would have cleaned up. Sorry about all the eggs you ate in the corner there.
Oh, why is it so hot in here?
I deal with a little bit of a fever. Your thermostat gets jammed up. It happens.
There's definitely lots of fixing up to do. I don't know if we're up for it.
Yeah, a couple days ago, some wild bacteria came through. Some broken glass, some spills, lots of irritation around the heart. But that's your specialty, isn't it?
We do love a good case of pericarditis.
But this is bacterial pericarditis. We've never worked with that before.
Bacterial, viral, same difference, isn't it?
I guess, but we'll have to talk it over. I don't know.
All right.
You the bus. No. I can't.
It seems that Mr. and Mrs. Coltrane have found plenty to doubt with the past two houses. Will our last viewing be enough to satisfy these highly critical agents?
Please come in.
Oh, I like what I see.
So this cozy place features refurbished hardwood, high ceilings, and a modern kitchen. The central fireplace keeps it pretty toasty, but not anything above 38 degrees, so no worries about fever.
What about age? We don't want to see anything too old.
Understood. This place was built around the 80s, so I don't think you'll have a problem with that. And don't worry, there's plenty of acute pericarditis in the basement and a home bar.
Ooh, I like the sound of that. Have there been any tests done to make sure it's safe?
If you're worried about troponin tests, they all came back negative for heart injury.
It almost sounds too perfect. Do you know if there's any vitamin K antagonists or anticoagulants that live here?
Well, no, but... This is ibuprofen. He'll be staying here for 1 to 2 weeks.
Oh, I'm not sure how I feel about that.
We know how toxic we can get with our fellow PGP agents, but I've never worked with an NSAID before. I don't know what'll happen.
I don't like it.
If you're planning a 3-month stay, that'll be about 0.5 to 0.6 milligrams BID.
Okay, I think we can afford that. I'm just not sure how I feel about the roommate situation.
After viewing our options, it's time for our couple to make a big decision and choose the patient they'll be committing to for therapy. Will they find the fixer-upper of their dreams, or will there be some unexpected adverse events?
The first patient had some serious idiopathic acute pericarditis that we'd love to treat.
But it was pretty old, and I don't know if I want to live with that PGP inhibitor. What about the second patient?
I'm not really confident in being able to treat bacterial pericarditis.
Yeah, but is that a hard exclusion?
I didn't really notice any risk factors in the last patient.
I don't know about that NSAID. Could be a problem.
We'll give Mr. and Mrs. C some time to think over their options. Let's see what the home audience thinks. In the next few seconds, please type in the chat with the number of the house you think that their final pick should be. If you thought this couple would choose house 3, you are correct. This is the perfect patient for Mr. and Mrs. Coltrane because it is young and has idiopathic acute pericarditis. The first house came as a package deal with a roommate that could have some bad interactions, and the second featured bacterial pericarditis, which is not something the couple could handle. Although Mr. Coltrane was concerned about the NSAID, after discussing it further with their pharmacist, they realized that this would not be a problem for them. In fact, this combination is actually recommended for their expanding career of treatment of pericarditis, and the NSAID plans to move out when there's a resolution of symptoms. This patient also tested negative for troponin, indicating there was no injury to the heart. Overall, the couple should be very comfortable in their new home, and we predict success in their new career.